Welcome. Chronic shoulder problems is a major epidemic. I want to go over some short, quick, simple exercises you can do at home to break down that adhesive capsulitis, that frozen shoulder, that adhesions, the scar tissue that's forming within that shoulder area. So you see here, I'm just standing in a doorway. I'd like you to get close to a doorway, at home, wherever you are, and we're going to do a few different exercises that's going to release that chronic contracted shoulder. The first one I want you to do, I just like you to lean back like this, and I just like you to put your palm straight out against the jamb of the door. Your arm is almost straight, and what I like you to do is I like you just to rotate your arm clockwise and counterclockwise. You see what I'm doing here? If you look at this, it's called supination and pronation. When we do this, we're putting pressure into the humeral head, into the acromion region, right in the fossa, as we rotate our arm. Now, notice that my hand, okay, does not move. It's just rotating the arm, supinating and pronating just like this. As we're doing this, as we rotate left and we rotate right. It's just like clockwise and counterclockwise. You're just going to do that for about a minute or so. The next stretch we're going to do is that we're going to address a little bit of the Latissimus Dorsi back here. You have muscles, the teres major and minor, the lats that attach behind the back of the shoulder area. I want you to just grab the door jamb like this and just lean your body back. Great. You're going to pull on that about 25, 30 seconds. Come a little lower, and I want you to pull back again as we work a different angle of the muscle, as we open up the shoulder joint and stretch those muscles behind the shoulder region. And then I want you to come nice and high and just lean back and down, and you'll feel different muscles start to stretch as well. Great stretch there. Next thing I want you to do, I want you just to walk up to the door jamb like this, the back of your hand up against the door jamb. And what I want you to do, I just want you to leave your hand there and lean your body forward. Lean into your elbow and keep your hand there. And let me tell you, this is a great stretch here. You're going to really work the posterior, the back part of the shoulder area, and the lateral part. So keep your hand, the back of your hand against the jamb. You're going to bring your body up against the inside of the elbow like I am, and just lean into it. Keep your arm there. And it's really, really, really going to burn in there. Now just go gentle. You'll hold it there a good 35, 40 seconds. Beautiful. The next simple exercise, we're going to stair step up the door jamb. Take your fingers just like this against jamb. I just want you to walk it up. I notice a lot of people out there are going to have a hard time lifting their arm because of the pain, but just go ahead and walk it all the way up. Good. Use your fingers, walk it up as high as it can go. You hold it there for a few seconds and walk them down. Go nice and easy. Good, because when you have this chronic adhesions in the shoulder, it's hard to lift the arm. I want you to walk up again. Good. Now, don't worry about how long it takes you, but by using this stair-stepping motion, this is really going to be effective to restore mobility back into that shoulder region. Now, you can stair-step about 6 times or so, and that should be suffice. Now, another great stretch we can do, once we get our hand above our head, if you cannot get it above the head and lift it, you can use your other arm, or you can stair step your way up above your head. I want you to put the palm of your hand like this, okay? Grab onto that ledge right there of the door jamb, and you see my arm here is at 90 degrees. It's kind of horizontal, almost horizontal above my head. And once it's in this position, I want you to lean your body forward. Good. And just hold that stretch a good 30, 35 seconds. You really feel that shoulder really open up. You see, we're trying to hit it from all different angles to release those adhesions, to restore mobility back into that shoulder area. Excellent. So do those simple stretches. Those adhesions need to be broken down. As you restore mobility into the shoulder area, each day you're going to get more range of motion and more function. The ultimate is getting out of pain and using your shoulder once again. I ask you to share this video with others so they can benefit. Subscribe so you can continue to receive more self-help videos. And most important, Make it a great day. I'm Dr. Alan Mandell.